2, 1. Hi, Catherine.
Hi, welcome everyone. We're live here with Dr. Susan Jamieson, and she's in Hong Kong. And I wanted really to share some of her amazing knowledge and years of experience in treating illness and treating particularly viruses. So to start, I wonder how things are in Hong Kong. What's the energy
Things are
like?
totally miserable. Shops are closed, banks are closed, cinemas are empty, libraries are closed, gyms are closed. People are coming into work in the shops later and they're closing early. It's really horrible, Catherine. So it's not good. Everyone's in this state of acute fear and wearing face masks.
Yeah. And how do you think that how do you think that fear affects our health, and our well-being? I mean, do you think that's
Well, it's
any,
undoubtedly detrimental. I was talking today about how I used to work in a respiratory infectious disease unit, and it was in Hong Kong. Tuberculosis was a big thing here, and no drugs could treat this. It was called multi-drug resistant tuberculosis. So if any of the doctors and nurses had got it, we would have died because it was untreatable. But guess what? No one did get it. And most people didn't even wear masks because we're healthy and our immune systems are good.
yeah,
So, that's it's really important to maintain your immune system, and stress or anxiety is known to deplete all the immune cells. The actual adrenaline, cortisol, stress hormone has been proven to reduce your immune system.
right? So what are ways that people can treat themselves at home or be protective? Of course, you mentioned the stress and taking care that way, but are there certain
Yeah.
things that could be doing at home?
Well, of course, not going to really crowded areas. I mean, to be honest, subways, if you can avoid them, it's better to, isn't it?
Hmm.
Really crowded areas is sensible. However, at home, as you say, look after your health. Now, vitamin C is our friend, at least 1,000 milligrams twice a day. Got zinc, a herb called astragalus is proven to be immune supportive, about 1 gram a day. So there's lots you can take. I mean, don't take all the rest of the stuff, do you know what I mean? But specifically, I think look after your immune system that way.
Yeah. And you have some great treatment that you're offering as well at the clinic.
Well,
Can you
we
tell us
are.
about that?
We've got an antiviral package, immune boosting. It's scientifically based, and it involves about 20 different things that, natural supplements that in combination really will boost your immune system. And I've prescribed that for a month. But the next thing I've done is a package to actually treat. It's flu season, right? People get sick. So a package to get rid of those viral infections really quickly for people. And then third thing is an immune boost, an immune check medical to make sure you really are physically healthy with regards to your
Hmm.
immune system through blood tests, etc.
Okay, wow. And how long do those test results take to come back?
The test results will only be 3 days.
Hmm.
The supplements are for prevention, you take for 1 month, and then the treatment package is for 2 weeks. Other people get better much more quickly. So I'm doing something really positive about this. And I'm also telling people, Catherine, that this is not a deadly virus. I don't
Hmm.
know why the press keeps using this term. About 2% of people are dying from this virus, and SARS was 10%.
Yeah,
MERS, Middle Eastern Respiratory Syndrome, 30%.
yeah,
So it is not deadly at
right.
all.
They are talking as well about the spread of it, like how
Yeah,
widely it
well, it's
spread.
infectious.
Yeah.
But so is influenza. And influenza epidemics are not fun. Do you know last year,
Mm.
but about 250,000 people died of influenza in the world last year? What's that? About 12,000 a month? It's
Yeah,
a lot, right?
yeah,
So in a country as big as China, 1 billion people, we've had about 700 deaths.
yeah. So
So there's a
far.
lot of excitement here
Hmm.
about
Hmm.
an infectious virus,
Yeah.
and it's not really based on fact or logic.
Right. Yeah, and we're accessing all of it, We just have so quickly to access just such a small,
Well,
activity that's
the
going on.
media, what we have to it's quite bizarre, really. I mean, as I said, according to WHO, 500,000 to 750,000 died of influenza in 2019.
Mm.
That means like maybe more numbers, like 750,000, if you include cardiac complications. Like someone got influenza, then they died of a heart attack because of it, right? So the figures depend on the actual cause of death. But that's a lot of people, isn't it?
Yeah, it is a lot of people.
And we didn't read about it in the newspapers like
No,
this.
no, we didn't. It's
Yeah.
sensational. But, it is, there are still people who are concerned about it. So how can people reach out to you and find you? Can they see
Well,
you
no, I mean,
online
we're
as
all a
well?
little
Or-
bit concerned. Yeah, my website, it's drsusanjameson.com, and it's a little bit difficult. I have such a big website. It's under Health Articles Clinic News. Clinic News, because we've got all these packages from the clinic under Health Articles. But sure, with my experience of viruses, I was consulate advisor during SARS. We had the SARS in 20 years ago almost. I kind of, I look at facts. I look at the fact that SARS was frightening because about 10% of people who got it died of it, and also young, fit people. But this virus, 2%. So I do believe that we should protect ourselves and be careful. I don't want to get it by taking something a bit extra. And so I provided these packages for that purpose.
Great, that's fantastic. And I will link to that as well in the show notes below so people can access you.
Thank you.
I just want to thank you so much for being so generous with your information, the article that you produced and the focus that you're putting on the community as well. I really appreciate it.
Oh, well,
And
thank you,
being here
Catherine.
today, yeah, as well.
It's
Just
lovely to
reassuring
talk
people.
to you.
Yeah, it's
Looking
nice
very
to catch up.
tropical in New York, if I may say, but a bit more than we are right now.
All right. Well, have a lovely
Nice to speak
day.
to you.
Thank you so much.
Bye.
Bye-bye.